Hello, welcome to Infocus. I'm Bradley Valenaki. We are already a quarter of a year into the second year of the global COVID-19 pandemic. There are talks of a vaccine to put an end to this global health crisis. And here in Papua New Guinea, it's already here, a vaccine called AstraZeneca. Is it the answer that Papua New Guinea needs to put an end to the current distance between us and those around us? We will find out. For now, I have with me in the studio Dr. Daoni Esorom, the now newly introduced Deputy Controller of the COVID-19 response in the country. Sir, welcome to the program.
Thank you, Bradley, for having me on the show again. I think this is the second time that you have me,
course.
and I'm honored to be here. And let me just say this: that I want to thank all the media, including TV, the print media, and also other media channels that actually have helped us to spread the information and news and to educate our people on COVID-19.
You have been elevated to the Deputy Controller. Tell us about this.
PM announced that NDC made a decision on Monday last week to appoint me as a Deputy Controller. I've been leading the team in the department, the Executive Manager for Public Health, since the pandemic started. We planned for the pandemic last year in January. And then I've been the Incident Manager since. And due to the death of a late colleague, Dr. Pasien Dakolala, I essentially replaced him to be the Deputy Controller.
All right. So to the vaccine now, the COVID-19 vaccine, the rollout.
Vaccine is the end game, and I'll explain why I'm saying it's the end game. On the 16th of July last year, our Prime Minister, Honorable James Marape, launched our national policy, public health, identifying the public health interventions that needs to be in all workplaces, all schools, private sector, government sector, homes, communities, a policy called the new normal. The new Plapasin. So it essentially identifies the prevention of public health interventions and prevention options that we need to take in these places or dwelling places so that we'll minimize the impact of COVID-19. A lot of the interventions in the new Plapasin, as we relate to in PNG, but globally it's called the new normal, are essentially the public health interventions that would lead to the reduction and prevention of transmission of COVID-19. People don't comply, it's definitely not going to help us in terms of reducing the number of COVID-19 infections. Vaccine will do, will help us to reduce the numbers, and I'll explain that later on during our discussions.
Right. Yeah, so in the vaccine rollout, health workers have been given priority, followed by those that are vulnerable to COVID-19.
If you look globally, there's challenge in all countries trying to get the whole of the vaccines. And PNG is so lucky that we signed up to the COVAX facility in December 7, 2020. And 20% of our vaccines that are required to vaccinate our population will be purchased or procured to the COVAX facility. So before we submitted our expense of interest to the COVAX facility, we had to come up with a national vaccination strategy. So under the national vaccination strategy, we identify 4 categories. Okay, that is basically a priority listing. That can change anytime if the number of vaccines and manufacturers globally increase the output of vaccine manufacturing. So our 4 categories in PNG are: number 1, frontline workers, category number 1. And under frontline workers, we have 11 subcategories. And under the 11 subcategories, I'll just mention some of them. Frontline workers, and the first subcategory is health workers. We also have under the category hoteliers, or hotels that quarantine people in Banpanji just coming in. We also have the airlines, our frontline workers who carry passengers and also have a lot of interaction in our airports. We also have Department of Transport, National Airports Corporation, staff. We also have teachers, the police, Defense Force, CIS, people in the front line. So that's category number 1. So there's 11 subcategories after that. Under that category number 1. Category number 2 is people with existing medical conditions. and some of them includes people who have hypertension, people who are diabetic, people who have asthma, people who have chronic airway diseases, kidney diseases, heart problems. Those are the people that will be the next one in the queue to be vaccinated. Category number 3 is, according to our population pyramid in the country, people who are over 50 years old. Our population pyramid and profile is different to other countries. If you see other countries, they're probably looking at 80 or 70 years. We are looking at 50 years old. And then the last category is the general population. And let me just clarify, in the general population, we will be vaccinating people starting from 18 years old and above.
Why is that?
According to the clinical data and information that we received when we were going through the profiles, the clinical trial for the AstraZeneca Oxford vaccine, the trials were actually conducted and effective in the age group of 18 years and above. That's why we have to go by that age group. Later on, it might change depending on other vaccines that might come in that probably the vaccine can actually protect people lower than 18 years old. But let me just say this: if you see what's happening in the U.S. now, the U.S. have actually started vaccinating children 6 months and above to 17 years old. They have the technology, they have the resources to actually do it. And most importantly, Pfizer and BioNTech have actually did clinical trials in these lower age groups to enable them to actually vaccinate these children up to adolescents.
There are third-party donations, and we've seen that from Australia, first of all. Are we expecting more from other countries? We,
as I've mentioned earlier on, we signed up to the COVAX facility on the 7th of December through 2020 through an expression of interest. It took us some time to actually address regarding 2 issues or surrounding 2 issues, and they are indemnity and also liability. In the event that our people get vaccinated and they get side effects or severe side effects, that may render them to develop severe side effect or even death, who's going to be responsible for those. So we have clarified that with the COVAX facility, and hence at the end of last month, we received the first batch of COVAX facility vaccines, 132,000 of them. But while receiving that, prior to that, we received 8,000 vaccines, and that was given to us by the government of Australia. Over 240 staff at the Port Moresby Hospital were infected. Mount Again at the same time were operating at 40% of their full capacity. 70% of the staff, frontline workers in one more hospital were infected. So this is the kind of impact that COVID-19 can have in our frontline workers. They're in the frontline, they deal with patients, and they can be infected. So whilst when we were seeing that, that would have led to our health system collapse, because our health system is classified by WHO and the UN as a fragile health system. So if we have most of our health workers, the frontline health workers becoming infected, other people would come with other conditions. The chance of you being seen by a health worker probably be remote if most of our health workers are infected. So our health minister wrote to the health minister of Australia if they could assist, and hence Australia was kind enough to give us 8,000 vaccine, AstraZeneca vaccine. Let me just clarify here, this is the same vaccine that we are getting through the COVAX facility, but the vaccine that we will be getting through the COVAX facility will be manufactured in India through the India Serum Institute under a brand name called Covishield. But it's the same ingredient, the same vaccine, but under a different brand name.
Interesting conversations there. We'll go for a quick break and return with more on the other side. This is In Focus. Welcome back. Now, before the break, we spoke about the vaccine rollout here in Papua New Guinea, the COVID-19 vaccine. Now, from an online poll Infocus did about 2 weeks ago, the figures showed on social media, on Facebook and on Twitter. Users say about 43% said yes, they are willing to take the vaccines, and about 57% said no. It's a personal choice, we understand. And also, we went out on the streets to see what people had to say about their thoughts of the vaccines and also the current national response here in Papua New Guinea.
Some of our developed countries always seem that Marasin now we PNG team we will roll out now. Or maybe sometimes less. Because so developed countries are doing more good or ablo. Check Morista, Marasin number with a good law, no good better bemo, good side bem, over testing good now by Omanza, Simeting him out. You mean no gardener. You mean just kind developing countries, you mean no good something by taking Marasin, or something you just teach him nothing come now. You mean to go roll out to make him, me know how much of him because you have some no good time by me down. And I want to effect them can be into you mean so.
Side low white line as low body system low lotion. Sigem affecting all true no dina. Side low mibla was low PNG system body low black line so. Mibla no sigem come up strong lo mibla pass die out. Also so meeting was a side meeting was a mibla if mibla no sim marasin meeting was still sige banana affecting mibla lo losing life lo mibla.
Papua New Guinea have no more life lo mibla. No need to put a mask, no need to wash him like no one in the boat. And me play bone lo ground now, me play sleep lo ground. So me play no same white man, wash him man like an boat now. Cook him suit or cook him marasi. And no more life, me play all grassroots line, me play okay. Me play no need him marasi or mask.
So side lo desla see came through and come lo country lo me play. But lo me at meeting me lo Highlands. So it is la sick and sick blow me plalo Highlands. Because Soltupuna, find him this la sick me plato him this la sick and mista. The country blow me believe or some. Country blow you me I'm no more sick blow me pla. Next sick rap, cough, head fan, na skin guria. This la kind sick and blow me pla.
Lo miet mi look was him. One plus some stop backside lo miet mi look him. And one system government is stop close to. Jisla la come inside na outla like on side na tupla fight na mel. Nansila system, sila one system government come place kila now. Si sick and but December finish all gata. That's the ember replace him. No world back come to Papua New Guinea. No back benefit na kajelo here. Jisla ground blame me paradise. Somebody ready that's all. Jisla sick here. Me brother me talk straight to you. Me looking I'm here single block God.
But mixing because me experience plenty lockdown there. That's the I'm now. We want to be good because one man. Or Prime Minister now, head of department, and Mamora Mr. Vaccine. Now, you don't know why all vaccinate minister, Ben and look extend it, you make at Marasin Lena. Why you make lockdown to me, block of all stuff? Was you make at Marasin Minister now, or Prime Minister now? I think they would meaning now. See, on a plenty of man of vaccine. I think a frontline workers, especially on health number 2 and vaccine, but you make at Marasin Lena, why you make lockdown to stop and block of Paul?
COVID, ingat. COVID ingat budget blame all ponde kancel of PNG. So all to COVID but all months is sick nothing all to COVID. This la budget there all need law buy one big machine law skinny more man through si COVID or no what. So all need law buy this la kind Sunday na puti.
So Dr. Daoni, your take on this?
Yes, thank you, Bradley. Vaccine does 3 important things. It prevents people from getting critically ill, it prevents people from being hospitalized, and it prevents people from getting severely ill, and it prevents people from dying. So even if you are vaccinated, if we don't achieve the 70 to 80% coverage of vaccinating our people, we will not. That's when you achieve herd immunity. We are not there yet. So even if you are vaccinated, you still have to wear your mask, you still have to hand sanitize, and you still have to physical distance. And let me also give this advice to people who have not made up their mind. Please get your vaccines. First dose, and for the current AstraZeneca Oxford vaccine, we're giving 2 doses, 12 weeks apart. So if you get your first dose, you are not protected until you get the second dose. And the evidence is showing us that after the second dose, 2 weeks after you receive the second dose is when you are protected. So please let me encourage our people, don't consult what I call Dr. Google, don't consult Dr. Facebook. They are faceless doctors who have not gone to medical school, who have not worked in an hospital, who have not vaccinated any people. So please, make sure that you get your information from local doctors, and a lot of our doctors are doing good work out there, including nurses and all the other workers, spreading the right information on vaccination.
So, Doctor, from the response that we've been seeing from people, is it a lack of awareness? We understand there are hundreds and thousands of kina put into awareness. Is it a lack of adequate awareness right down to the people that need it the most, or is it just plain ignorance?
Bradley, that's a very good question. Let me just say, yes, we do have challenges putting out the correct information, but let me just say, we are also fighting against the myths and misinformation that people put out there. People now, there's a lot of people on Facebook, there's a lot of people on Twitter, social media for that matter, but there's a lot of people out there who are also strong advocates against the vaccine. So we are fighting against those people, or not fighting against, but competing to actually get the right information in. Yes, we do have challenges, but Bradley and listeners, let me just assure you, we are launching the national vaccination program on the 4th of May, and the national program vaccination will start on the 5th of May. We will ramp up, we will saturate all channels of media, print media, TV. We also have engaged a lot of community. We're encouraging the PHAs, provincial health authorities in the provinces, to engage theater groups, because different people get information from different sources. So we'll saturate those channels of communication to make sure that we give the right information to our people, so that they can be protected and then spread the good news on vaccine. But we also need to address the myths, the misinformation, the conspiracies, and that comes under our cluster on risk communication. So we will be ramping that up. But let me encourage people here, and let me just say, vaccine works. Vaccine protects against COVID-19, and the evidence that is showing us globally that if we immunize 70 to 80% of our population, two important things will happen. We will cut the transmission of the virus, and we will prevent variants from coming up. So let me just briefly explain on this briefly. If you see what's happening in India at the moment, one person can be infected with 2 or even 3 different variants. Why? Because the infection is spreading widely in the communities, and when you have that, the virus itself also want to spread easily. And as we said, the virus changes to forms where it can easily be transmittable. So those are the risks that we run. Fortunately, in Papua New Guinea, we've not detected any of these other variants yet. We have a variant called B16, which is a variant that has come out of our gene sequencing, and we've done a few gene sequence. We sequence some of the positive samples from PNG, and the challenge for us is looking down the borders to make sure that we don't get the variant in. But if we do get vaccinated, and if we follow the new passing, Bradley and listeners, we definitely will protect COVID-19 and will prevent these other, what we call virulent or more dangerous variants coming into PNG. And the more dangerous variants, if they do come, a lot of people will get sick, a lot of people will hospitalize, and believe me, a lot of people will die.
Deputy Controller of the current COVID-19 response in the country, we appreciate your time with us.
Thank you, Bradley, and thank you for having me on the show. But let me just say before we close, Bradley, please get your vaccine. It's going to save you, it's going to save your family, it's going to save our communities, and it's going to protect our country from COVID-19. Thank you very much for having me on the show.
Yes, Dr. Daoni, I will definitely do that. I will have to practice what I preach. Don't go away. On the other side of the break, we speak to WHO's Dr. Deborah Battles. That's coming up right after the break. Welcome back. This is In Focus, and I'm privileged to now have with me in the studio Dr. Deborah Battles, the immunization coordinator for WHO Papua New Guinea. Doctor, thank you for coming onto the program and speaking with me.
Thank you very much for having me. It's really an honor and a pleasure to be here with you.
All right, so Dr. Deborah, we'll speak a bit about the vaccination program that's currently being rolled out here in Papua New Guinea. First of all, the AstraZeneca vaccine, what it does to the body is something that I think we should discuss on the program. Many Papua New Guineans still don't know what this vaccine does to the body.
AstraZeneca, like many other vaccines, it works by, you can say, giving instructions to your body, especially your immune system, on how to fight a potential infection. Again, in this case, it's against the COVID-19 causing virus. So this vaccine, it delivers those instructions, and your body starts to make antibodies and develops infection-fighting cells that can recognize the AstraZeneca virus. That can recognize the coronavirus if you get infected. If your body's prepared already to fight this virus, it is very protective to you. You do not get severely ill, will not require hospitalization.
People still need to understand that preventative measures have to still be observed after even being vaccinated.
That's very true. So even after receiving vaccine, you should continue to wear a mask and limit your time in large crowds, and continue to physically distance. That is for many reasons. For one, it will take quite a long time for the majority of people to be vaccinated. The other reason is that although the vaccine is quite good, it may give you, say, 60, 75% protection. So there is a chance that you could even get infected, have a mild illness or an asymptomatic illness, and be able to pass that on to somebody else who's more vulnerable than you. So to avoid that from happening, we advise to continue to wear the mask, even if you do get vaccine. We've actually received in PNG 132,000 doses. That was in April, on April 13th, the vaccine came in. I think a few days after that, there was an official ceremony that people may remember. But those vaccines are here in PNG, and in fact, they've been distributed out to the many provinces and are being safely stored there in their special vaccine cold chain or refrigerators. There is a difference in how they are administered or how they are stored. The Pfizer vaccine is the most difficult vaccine to store and to administer because it requires a negative 70-degree storage. If it comes out of that cold temperature, then it may be rendered totally ineffective. It also has to be diluted, so that's an extra step and makes it more hard or more difficult to administer. The second vaccine, the AstraZeneca vaccine, on the other hand, is much easier to store. It's stored in a normal it can be stored in a normal refrigerator-like cold chain. We always recommend using the special approved cold chain, or that for vaccines we call it a cold chain. It's like a refrigerator. So it can be stored from 2 to 8 degrees, and that's about the same temperature as your domestic refrigerator at home. So it also does not have to be diluted or mixed. It can be used straight from the glass vial that comes from the manufacturer. So it's much simpler. And then the third vaccine, it only recently was approved. So I think it took another at least a couple months before it was approved after the AstraZeneca vaccine. So it's also stored in the same cold temperature and requires one dose. Similar efficacy and safety profile.
So I guess the bottom line for these other vaccines not being used in the country is probably cold storage and the way it's been administered. I think those are the factors why.
It is. I mean, that's why AstraZeneca was selected. When AstraZeneca was selected, the Johnson & Johnson vaccine had not finished clinical trials yet.
So that means we can still look at Johnson & Johnson's Janssen for consideration probably in future?
It's possible, yeah, it's possible. If it were to be, available, you could consider it.
In terms of these three vaccines, Pfizer and AstraZeneca, 2-dose vaccines. Johnson & Johnson is 1 dose. So in terms of the figures we're looking at, in terms of the vaccines that will be used in Papua New Guinea, the 2-dose, is that been filtered into the 588,000 vaccines that we will be using on shore?
The 588,000 doses, that was doses. It was not persons to be vaccinated. So it is kind of tricky. Sometimes if you have to kind of, I guess they say, read the fine print carefully. So sometimes if they say we can vaccinate, 10 people for a full treatment cycle, then that might be, if it's 10 people, that would be 20 doses. So it was 588,000 doses, I think, that they guaranteed.
This would mean that we probably would vaccinate about over 200,000 people.
Yeah, you can say that. Yes, that's good. That's
all right. So, Dr. Bettles, in terms of the response here in Papua New Guinea, how is WHO seeing the response carried out by the authorities here in PNG?
Well, I think it's moving along according to schedule. We actually received the vaccine a little bit earlier than we had planned. Because initially it was scheduled to arrive by the end of April, so the vaccine actually arrived earlier. It was not the full 588,000 doses, but it was 132,000 doses. But that's a good start, and that's been distributed to the provinces. And now I think that every province is working on further preparations.
Dr. Bettles, we thank you so much for your time on the program with us. WHO has been a really good partner of Papua New Guinea and the Department of Health in the fight against COVID-19.
You're most welcome. Happy to be here.
All right, this has been In Focus. If you have comments on the program tonight, you can email us on the email now showing on your screen. That's infocus@emtv.com.pg, or you can engage with us social on Facebook, Twitter, and also watch this program and other episodes later on YouTube. From all of us here, thank you for watching. Stay safe. Bye for now.